Hi, I'm Dr. Steven Goldstein, and I'm speaking to you from the New York University Grossman School of Medicine here in New York City. This is another in our series of reducing the confusion in gynecology. And what I'd like to talk to you about now is the concept of telemedicine. This has become very popular, especially in our era of COVID, where more and more medical encounters are being done by telephone or FaceTime, as if this were a regular visit. I have a number of things that I'd like to share with you about that. In the first place, the way I practice gynecology is with very liberal use of the transvaginal ultrasound or vaginal sonograms. It's important to examine the pelvis with the ultrasound to see, is there normal mobility of organs? Is there pain with these organs? Is it truly enlarged or irregular in shape because of fibroids or a cyst on the ovary? I cannot do this over the internet or by telephone. In addition, I have always called patients back. Sometimes patients will email me, and I don't type very well, and I'm very, very verbal. And so what I do is I like to call those patients back so that I can explain in great detail and listen to them tell me what the situation is. Gaining a good history and listening to a patient is so important. And so when I think about it, in some respects, I've been practicing telemedicine for years. I don't go home until every patient who has called is called back. I don't charge for these calls. It's part of my overall service. I guess you might say I'm a dinosaur and I'm somewhat old-fashioned, but that's the way I was trained, and that's my brand of telemedicine.